Good evening from wherever you guys are. I'm just finishing up my day seeing patients here in sunny Southern California. Busy day and a busy day of me using zirconia to make same-day crowns. So tonight we're going to discuss I think my favorite dental material or dental crown material that I use every single day and multiple times a day and have had great success with, which is zirconia, and how we use and leverage the CEREC system from prepping to designing prepping in a matter of minutes, designing in a matter of seconds, and then getting it fabricated in about 20 to 25 minutes, and then getting it cemented for a very efficient same-day workflow. So that is the goal for tonight, and we're going to talk about different zirconia materials and kind of my go-to of all the zirconia materials that are out there. The first thing I like to do in all of my lectures is to show this quick video. The video is very self-explanatory. It's how many passes does the team in white make? So focus on the team in white and how many passes they go through in about the next 15 or 20 seconds. And the answer is 13. But I'm going to rewind the video real quick because that wasn't really the point of this video. The point is, did you see the moonwalking bear? And I think as dentists, we're so focused in on certain tasks that we often don't look at the whole picture, and we don't see Mr. Moonwalking Bear walk across the middle of that video. It's easy to miss something you're not looking for. One of my big mantras that I have is the eyes don't see what the mind doesn't know. I'm going to say that again. The eyes don't see what the mind doesn't know. Once we know something, or we're taught something, or we're educated, we can never unsee something. So if any of you guys ever see that video again, you'll know what to look for and don't get caught up looking at how many passes the team in white make. My goal today is to essentially educate you on how to look at zirconia, look at all the zirconia blocks on the market, and know that all of the zirconia is not the same. There are differences to each of the zirconia blocks, and it comes down to the composition, and therefore different compositions of zirconia are going to have different strengths and different translucencies. And there's going to be some pros and cons. So if you're doing essentially two-visit dentistry where you're sending it out to the lab and just writing down zirconia, you're going to essentially leave it to the discretion of the lab to figure out what type of zirconia they're going to be using in particular cases. Or if you're going to be doing same day and using the power of the CEREC technology, know what type of zirconia you're using, why you're using it, and which one I think will give you the best outcome. So that's what we're going to get into, but a lot of you don't know who I am. A lot of you can't see me. This is me about 40 years ago, and I am the product of two dentists. I was born and raised in that dental practice. I would work there, not the age of 3, but I would work there during high school. I actually was told by my mother not to become a dentist, and I didn't listen to her very well. I had my dad who was what he'd like to say, he wasn't a dentist, he was a tooth carpenter, but really took that tooth carpenter kind of model to heart because he focused on just single tooth dentistry and did one tooth at a time. And when we practiced together, I kind of got a little bit frustrated with that mentality. And I also got frustrated with not being able to use the advances in dentistry to its full capability. The reason, or one of the reasons that I got into CEREC and into same-day dentistry was my hatred of temporaries. That hatred of temporaries stemmed from my psychological scar in dental school. And it started one day, I think year 3, I was on emergency clinic. I get my fancy pager that goes off. I go to the emergency clinic window. And when I get there, I turn around, I get handed a chart. I call the patient's name out. And you know those cartoons where you see like full arm cast, full leg cast? That's what the patient is sitting in a wheelchair. And I go up to him like, dude, what happened? How can I help you? And he's like, I broke my temp. And I'm like, no, I'm talking about your body here. And he's like, I was a janitor for the local hospital, up on a ladder. They had a code. They were wheeling down a bed and knocked the ladder out from underneath me. I fell from the ceiling and literally broke almost every bone in my body. He was in the hospital for several weeks, recovering, had just got released to rehabilitation center, and now could focus in from the fall that broke his temporary. And then I'm thinking to myself, I can handle this as a third-year dental student. I can handle fixing a temporary. So I wheel him back. Luckily, he doesn't have any caretakers with him. I'm a big enough guy. I get him in the dental chair. And I look in his mouth, and it's not a 1-tooth temp. It's not a 2-tooth temp. It's not a 3-unit temp. It is not a quadrant full of temps. It is a full mouth rehab that this guy had broken. I have no records to go off of. And this is the early 2000s where we didn't have any of the digital technology at my hands. And I have to go ahead and salt and pepper with acrylic a full mouth rehab back together. It took me several hours. Guy was super patient. I think 6-7 hours later, we get it done. We get him temporarily cemented back in there. And he goes to me, I need to go to the bathroom, and I need to go to the bathroom fast. I get him back up in the wheelchair, and I'm running across the dental school, and he's like, by the way, you need to bring cups, and you're going to have to help me. We get to the bathroom. I get him in there, and he's like, where are the cups? I get his pants down, and I am now helping this guy go to the bathroom, and he asks for cup number 1, and I give him a Dixie cup that is all of 3 ounces big. He fills up Dixie cup number 1 in all of 2 seconds and now hands me a cup of warm urine. I don't want to even be holding my own cup of warm urine, and I just chuck that cup out of the way. He fills up cup number 2. I'm throwing them in the trash can. I'm throwing in the sink. I don't care where I'm throwing them. I just don't want them to be in my hands. And we get through cup number 4, cup number 5, and he's like, I still need to go. And now I'm going back in the trash trying to pick these cups up, handing him back, and we go back and forth, which seems like an eternity, but ends up getting to the last cup and then spilling it all over me. At that point, I knew as soon as I could never make a temporary again, I would get to that point. And that's what digital technology and same-day dentistry has allowed me to do. Now, did I make a temporary today? Absolutely. I had to prep a tooth, 2 teeth for a bridge and extract a teeth. So do I still do temps? Yes, I need to get that patient through the healing process. But same-day dentistry has allowed me to become more efficient, more effective with my patients, higher case acceptance. So if you haven't got into this world yet, I strongly recommend you doing that as soon as you can. So the goals of tonight, or the learning objectives, is to 1, review preparation guidelines for chairside zirconia. Now, I said each zirconia is different. So there's going to be different preparation guidelines for each particular zirconia that you're using. We're going to review pre-seeding protocols. How do we treat the zirconia to optimize retention? How do we get it as sticky as possible to allow it to stay on that tooth as long as possible? And how do we treat it and to make sure it's cleaned after we try it in? And then the one thing that I love about zirconia is it's a very forgiving material, and we can bond. And yes, we can absolutely bond to zirconia. We just can't bond it the way that we bond ceramics. Or because it is such a strong material, do we go ahead and cement it? And how do I make that decision in my head? And I'll go through at the end of the lecture today. A couple weeks ago, I had a Thursday morning where I was doing 3 or 4 crowns in a given morning, and I decided to bond some, I decided to cement some. And it just depends on certain scenarios and what the patient is going to be best ultimately for the patient for a long-term prosthetic for that particular patient. So that's the goal for tonight. But let's talk about zirconia here and the different types of zirconia. There's the monoclinic pure form of zirconia, and this is not what we use in the dental office. What we start to use is when we start adding yttria to the zirconia, what it does to the zirconia. And when we have yttria, we end up turning this zirconia into what's called tetragonal. It's a phase of the zirconia, And when we add 3%, we end up getting more tetragonal. Tetragonal is a very strong form of zirconia, and it's able to essentially transform if there's cracks that are starting to form. This tetragonal component of the zirconia actually acts like almost like a sponge, where it moves and fuses and essentially closes off the crack propagation and keeps those cracks at a very small microscopic level. So then the crown, when you have 3% yttria and more tetragonal portions of the zirconia, is a very strong zirconia. And that's the classic. And that's what I was first introduced to when I joined the CEREC world. I joined the CEREC world in 2015, 2016, right when the speed fire or the speed sintering oven came out. And at that point, I think it was about 30 minutes that it took for a crown to get sintered and to get fired in that speed fire oven. And it was a very, very opaque, almost, I will call it ugly form of zirconia, but super strong, like 1200 megapascals that first came out to the market, for at least for same day. I would take the crowns and I would put them on a wood table. I would hammer it. The crown wouldn't break, but I would see the imprint of that margin in that wooden table. That's how strong this material was. Those materials have actually been taken off the market because of the materials that are now coming onto the market. And we're getting into a 4Y or 5Y. When I say 4Y, 5Y, I mean the percentage of yttria in the zirconia. And as you put more yttria, you get in more cubic form of zirconia. So when you hear like cubic zirconia, fake diamonds, it's a very aesthetic because they're adding the amount of yttria into that form, getting more cubic, and it's becoming a much more aesthetic material. So you're, again, this conundrum that dentists are always looking at, the stronger the materials, the less aesthetic. The more aesthetic the materials, the less strong they are, or the weaker they are. And it's this balance of this yttria and the percentage that kind of determines how strong this zirconia is versus how aesthetic it is. So high strength for the 3%, 5% is more high translucent. And the way I remember it is the more cubic zirconia, that fake diamond, the more cubic that is, the more translucent it becomes. So again, as we go from the 3Y to the 5Y, higher strength on the left with the 3-wire, lower strength on the right with the 5Y, the lower translucency on the left, the 3Y, to a higher translucency on the right. So I started with a really strong, really ugly looking cubic zirconia that I only did in the posterior. And when I mean posterior, I was doing it on second molars exclusively. And then from the first molar forward, and this is 2015, 2016, I was using ceramics, Emax, those type of materials for my restorations. And if I had to do that, typically I was also bonding those restorations in the front. But there's been a revolution in the last couple of years, and every single year, the zirconia materials, the katana materials, the DS CEREC MTL zirconias. Now there's a brand new one that was just released this past weekend called Ivoclar Zirconia Prime. They're coming out with much more aesthetic, and I mean really good looking crowns that I can almost use in every single scenario. Posterior, great strength. But also sometimes in the anterior as well. If I'm doing a full anterior 6 or a full anterior 8, zirconia is a very forgiving, very strong, very aesthetic material. If I'm doing a single central incisor, I'm probably still using that feldspathic porcelain, the Empress, the Emaxes to get that. But if it's a big enough span, zirconia is often my material of choice. So this is the workflow that I use every single day. We have our prime mill, and as the mills are getting better, so is the time it takes for the mills to be made. And as the materials are getting better, there's a lot more materials coming out to the market. Ceric MTL is the one of them. We also have the brand new one that I had to look up and research over the last few evenings, which is the Ivoclar Zirconia Prime. And they also are coming in single units. And the aesthetic zirconias are also strong enough to go ahead and do bridges for as well. So if we need to do an anterior bridge or even a posterior bridge, but if we're doing an anterior bridge like I was doing today, where I was temporizing it in 4 to 6 weeks, when I'm going to make that final restoration, I can have some bridge blocks at my disposal. So we can actually still do an in-house milled zirconia restoration as well. And then the key for this, to do this chair side, to do this same day, is on the right side of the slide. The first one to the market was this the Dentsply Sirona Ceric Speedfire that was able to do speed sintering and allowing to shorten our working time or our sintering time down from several hours, 6, 7, 8 hours, down to a matter of minutes. And that's when I decided to jump on the bandwagon of doing Ceric, but also doing same-day zirconia. I was trained at the University of Pennsylvania. There was a lot of research done there on zirconias, so I'm very comfortable with using this material in my office. I love how it mills. I love the margins that it creates. So I'm very comfortable because I've seen all the research and how it works. So that's why I kind of was waiting for until we could do zirconia. I wasn't jumping into the same day market or buying the technology, the Cerics, to do same day. The other oven that just recently came out about maybe 2 years or less is the Ivoclar oven called the CX6. With their zirconia now can be sintered as quick as 15 minutes. And this is the brand new one that came out. You can also, with this oven on the lower right, the CS6, you can also program other zirconia cycles in there to get it under 25, in the 20 to 25 minute range. So you can do it's an open system, where the Speedfire is a closed system. All of the parameters are built into that oven and you can't program anything into it. But it's the oven that allowed us to do this chair side. And the other great thing is there's always improvements with the workflow. So when I started, Ceric used to be 15 minutes and 30-minute cycling. Then we got it down to a point where it's now, all it takes is 5 minutes in super fast mode for it to be milled in the prime scan. We now have the Speedfire oven down from 30 minutes down to now 18. Now we're seeing new materials come out that we can get it down into that 15-minute range with the CS6. So these materials are getting quicker to process and making it more efficient. And the funny thing is, when you ask these companies, as they shorten the sintering times, they don't know why, but the strength of the material was actually increasing as well. So you're getting a higher megapascals, not a huge jump, but we're talking about maybe 10, 15% when we went down from 30 to 18 on the sintering. The material, for whatever reason, was getting stronger as well. So one of the main reasons that zirconia, especially katana zirconian, is the workhorse in my practice is the milling. The mill mills this material at about 18 to 22% bigger than the actual final restoration. During the sintering process, the sintering process, the zirconia crown actually shrinks, and it becomes smaller by a percentage of 18 to 22. The mill knows this and essentially mills that material 18 to 22% bigger. That gives the ability to mill this in a much finer detail with much finer burrs, and you get a much cleaner finish. And the material is also like a chalky consistency, if you've ever seen any zirconia. And it can be milled in a much finer way. And you can see that just on the lower left with how clean that margin is. When you start getting into the glass ceramics, it is a grinding consistency. We have diamond burrs that are grinding this material away, and it's grinding it away at the exact same consistency or the exact same size as the material needs to be. What this can often lead to is some chipping, very microscopic chipping at the margin. But if we want a crown that's cemented and sealed to the utmost ability, I would rather mill a zirconia crown rather than having the Tesseras or the Emaxes or the Empresses or any of the glass ceramic like feldspathic porcelain have this microscopic chipping. And it just is a lot more forgiving, and the fit is amazing when you start doing chairside zirconia. So when I was doing these Emax restoration or Empress or any of the feldspathic porcelains, whenever I tried these crowns in, you could still see this little micro gap on the x-ray. And we would essentially fill that micro gap with our bonding agents and when we bonded the crown into place with our cements. On the right-hand side, that tooth number 30, you can see the intimate fit of that zirconia and how well the margins fit, and it fits every single time. And it's just very predictable, a very precise fit, and it's just made things in my practice and in my office flow very effective and very efficiently. And in my practice, we are a group practice. We have typically 2 or 3 doctors here at a time, and I need things to flow very smoothly and very predictably. I don't like remakes. So I want it done the first time the right way, and we're off and can be successful. And patients like to see things done the first time the right way as well. So the first thing I want to talk about, and I do a lot of training. I'm a resident faculty member at CDOCS, which is, I think, the preeminent training facility if you are getting into the CEREC workflow. But it's not just CEREC restorations. It is now the whole gamut of what CEREC can do. Implants, sleep, big aesthetic cases. We talk about SureSmile and ortho at CDOCS. But the first thing I always talk about or teach when we get into the CEREC workflow is prep. And when any dental restoration typically breaks, it's because we're not reducing enough. Now, this is what I use. You're going to see, this is a 2 millimeter reduction burr made by Meisinger, and this is what I recommend. Even if we have a case where we only need a 0.5 millimeter reduction or 0.7 or 0.9, you'd be surprised how much we're under reducing on these cases if we're not using a prep reduction burr. This is the burr that I use, the first thing I use on every single one of my cases when we're prepping. I drop this, I reduce it, and make sure I have, now you maybe think I'm over reducing at 2 millimeters, but if we start talking about putting anatomy and grooves and fossas, if you don't want a flat crown and a flat surface, you need to actually give a little bit more thickness to the material to create grooves and anatomy in it. So I would highly recommend doing this. You're going to make sure you get adequate thickness and adequate aesthetics and adequate function when we get grooves and fossas on these particular teeth. When I see CEREC or when I see any restoration fail, it's also typically it's due to a lack of reduction. And the great thing about the CEREC software is instantaneously, as I'm designing this crown, I'm not leaving it up to my lab technician to essentially leave an area under reduced. I am in charge of making that restoration, and I can see if I've under reduced that area. I can bulk it up if I need to. I can adjust the opposing, or I can go back and re-prep it. But do something to make sure we're getting this material at its adequate thickness to make sure we have restorations that are going to last a very, very long time. So the first thing is we need to have adequate prep reduction for these materials. We also need, if we're going to be doing same-day zirconia or same-day restorations in general, we do want a chamfer or shoulder preferred. It's easier for the camera to pick up, and it gives the mill an easier time milling out and getting us a very accurate margin. Now, What do I look for in my zirconia here? I'm looking at aesthetics, absolutely. I'm looking at strength. I'm looking at, can I do this same day? And if I can do it same day, when we start talking about minutes, 2, 3, 4, 5, 6 minutes, maybe it's not going to affect my decision on how fast it can be done. But when we're talking about hour and a half or 45 minutes or 30 minutes versus maybe 18, then yes, how fast I can sinter this in the oven helps. When I look at streamlining my inventory, what blocks do I need to have? How many blocks do I need to do? Those are things I look for. And then I also look at how often do I have to change out my burr and what's the maintenance that I need to do on my milling unit to keep it up and running and make sure it's not down and making sure I don't have to calibrate it. So each iteration of these blocks that are coming out are making my life significantly easier. They're becoming stronger every variation of the material that is coming out. They're becoming faster with how fast I can speed sinter this. And they're also the burrs that I'm using. It's easier on my burrs. And if they're easier on my burrs, I have to switch them out less. And if I have to switch them out less, I'm getting more mils per burr use and I end up saving money. So these are all the things that each time when companies come and ask me what I want out of a zirconia block, these are the things that I'm asking for. And I'm shocked each iteration of these materials that are coming out, they essentially are, I'm getting what I'm asking for. So this is one of the materials that we talked about, which is now, this is the new version of Katana. The old version of Katana chairside was called STML. Great aesthetics, had to be a little bit thicker. There was a couple different size blocks, which was kind of annoying that I had to keep a couple different size blocks out. They've streamlined it down to now 2 blocks. And I'll show you the prep guidelines here in a couple seconds as far as the Katana Zirconia 1. Now, what is the zirconia that Katana, or I'll call Katana Noritake, uses? Katana Noritake. Noritake is essentially the industrial side of Kurari, and they source their own zirconia and have their own proprietary formula that they use. The analogy I'll use is no one really knows the recipe that Coca-Cola uses to make Coke or Diet Coke. They know, they just like it and use it. Zirconia comes from a handful of mills or mines across the country or across the world. There's only about a handful, and all of these manufacturers use or source the zirconia from one of these 5 or 6 or handful of mines in the world. Kurari and Noritake have their own mine and are able to get this own zirconia and have their own secret recipe. And this recipe just works, is what I'll tell you. They won't tell you if it's 3Y or 5Y or 4Y or what their component is. Whatever their sourcing is and whatever their materials is, the aesthetics are really high, and each iteration of it comes out with a stronger material with less amount of tooth reduction needed. This is the multi-layer, and the great thing is there's not these big bulk like 2 or 3 layers. It is a gradual layer, so the incisal edge is more translucent, and then the body of the crown has more chroma into it to give it that natural appearance. There's no gradation gaps. It is a smooth transition through this, and that's where you get this super translucent multi-layer zirconia. Now, that's the original block that they came out with 3 or 4 years ago. They have now come out with their Zirconia 1 block. It still has this super translucent multi-layer with also increased flexural strength. So I think it went from about 750, if I remember, 800, to now the Zirconia 1, which is now 933 megapascals. So super strong, but we're also can reduce more. And we're also keeping it at that same 18-minute sinter for all shades. And it's increasing the burr life. And I don't have to keep as many burrs or blocks, I should say, in stock. So you can see on the top where the STML is, yes, we can do anterior crowns down to 0.8, posterior crowns are down to 0.1. We can do veneers as simple as thin as 0.4. I would highly recommend you bond those in, and we'll talk about the bonding techniques that we use. We have inlays, we have onlays, and then the big change to Zirconia 1 is we've increased how strong it is while also decreasing in the posterior. We only need 0.8 millimeters of reduction. And then the thickness of these bridges, the connector between the abutments and the pontics, we can actually streamline and get a little bit thinner now. We don't have to bulk it up for the posterior. We can get it down to 14 millimeters squared for the strength to make sure that the bridge doesn't block at this connector space. Now, this is the brand new one on the market. Literally, now Zirconia Prime and all of these blocks, all your labs have access to. They're now coming into the chairside market, and this is the one that was just released literally 3 days ago. Great anterior reduction of 0.8. In the posterior, they still want you 1 millimeter. But the little thing that I thought was misleading here, and you have to look at it, is they only have 3 zones. They have the highly translucent zone, and then they have the high strength zone in the dentin or the coronal part of the tooth, the translucent zone, and the incisal. The incisal zone is 5Y zirconia. So it is very aesthetic, but when you go to 5Y, you start to lose the strength. So it's 650 megapascals in the incisal zone. When we go down to the coronal part of the tooth, that is more of a 4Y or 3Y strength, and you can get a really strong zirconia, but it's only strong in the coronal part of up to 850 to 1200 megapascals in that coronal zone. To me, I want the whole thing as strong as possible, and I'm only as strong as the weakest link. So if my incisal edge or the occlusal surface in the posterior is only 650 megapascals, I'm still going to have some weakness there, and I'm going to lose some strength, and I'm going to potentially have some chipping or breakage of the incisal or the occlusal part of the crown, the part that actually is taking the brunt in the posterior when we're talking about posterior teeth here. So I'm excited to play with this. It just came out, but I'm a little bit hesitant because it has this mixture of 5Y, 4Y, and 3Y in different strengths. Now, the great thing about this material is it can be done in the CS6 in 15 minutes. So some benefits here. Now we're talking about a 3-minute difference between Katana 1 now and the Zircat Prime. Now, this is another material that's out there. It is distributed by Dentsply Sirona. It's actually manufactured by Vita, the CEREC MTO. Again, a great strength. We're talking about getting down into 0.6, 0.5 millimeters of reduction. But again, you're looking at 850 megapascals. So not as strong, kind of somewhere in the middle of what we just talked about. But another great material that has transitional layers, multiple translucency layers, and you have more incisal translucency with more chroma. I couldn't figure out what type of zirconia this is. Maybe they have their own secret sauce like Katana does. But these are the connector sizes and how we need to prep these materials if we're going to be using them. So this is my workflow every single day. This is what I do every single day, multiple times a day. Multiple people are doing this in my office at the same time. Multiple restorations can be milled and stuff like that. So what I always do in my practice is I always have a bio copy. I scan the pre-op, and I go ahead and then scan the post-op once I have this prepped. And I can always merge these files together if I need to see what the previous restoration looked like. This is the first step in the CEREC software is we need to go ahead and create a margin, essentially ditching the die. You can see when you give it a nice clean margin, how quickly it marginates the crown for us. Tooth number 30, I can zoom it in, and I've never always say, you know how good your prep is when you can zoom it in 10x, 20x, 30x, 50x. One of the tips I always teach in my lecture is to always flip when you're margining the restoration over for whatever reason, you can see that margin much better when you flip it from the inside or upside down. We go ahead and we design this crown and have the software design the crown for us. And then we talk about it in the CEREC world, FOCC, fissure, occlusal, contours, contacts. That's what I'm looking at. That small little dot of blue that you saw there, that was telling my eyes that I was a little bit thin in that area and I needed to bulk up that crown a little bit to get it. I'm now going to adjust my occlusion here, getting rid of the high spot. It's like a Doppler radar. So I'm looking for that light blue, maybe a little bit of turquoise for my occlusal. For my contacts, I kind of want a turquoise greenish color. I'm going to get rid of the yellow. It means my contact's going to be too tight. And I have now essentially designed my crown to be go ahead and milled out. I can overlay what the pre-op looked like. So you can see that speckle there means that my restoration final and before and after is almost identical. And then we can go ahead and we can go to the manufacturing phase. And this is where you can start to see the layers. We can go to super fast mode. These are the different sizes of the STML. I don't have to worry about this anymore with the Katana 1. There's only two sizes, a single unit and a bridge block. We can move the spruce to make sure it's not in the interproximal, and then we can also move this block up and down. So if I'm in between shades, I can move it up or move it down to give it more translucency, or move it down like I just did for more chroma. So those are the things that I fiddle with each and every day, and to make it very predictable, a very streamlined process in my office. And then we can go to super fast, which means we can mill this crown in just about 5 minutes, 5 or 6 minutes tops. Premolars I've seen done as quickly as under 4 minutes. We go ahead and mill it. We go ahead and put it in a crown. And then this is just talking about the history of sintering. If you were sending it to a lab 3 or 4, 5, 6 years ago, it would take ovens upwards of 7 hours. So the lab technicians would make all these crowns, put it into an oven, leave for the night, and come back in the morning with all their sintered crowns. Then we got speed sintering. We got it down to 90 minutes. 90 minutes is still something I can't do same day. It wasn't until we got under that 30-minute mark, and it went from 30 down to 18. Now we're going into the 16. Now, how do I process these once they're out of the oven? Do I go ahead and glaze them, or do I go ahead and polish them? Now, I'm using a lot of zirconia in the posterior. All of the research shows that when we polish and polish only, it actually is better for the occlusal, the opposing contact points, to polish only. The opposing surface, or the wear that a polished zirconia crown does, is the most beneficial to the opposing surface. The other thing is, when we have a polished zirconia, the gum tissue likes, the gingiva likes it and responds in a much better way. So essentially, by polishing only, and we can pre-polish this in the pre-sintered form, not too hard, a very soft polish with some Meisinger, what's called twist polishing burrs. I typically don't like to polish in the contact area because it's a chalky material before we sinter it. I don't want to remove that contact and take too much. But polishing shows that it's better for the opposing surface, and also better for the tissue. It's almost, I always call it, this is my white gold when people, can I have a gold crown? Well, gold costs a lot. Zirconia does not cost that much. I can do it the same day, and it gives me almost all of the same benefits as a high noble gold crown does. Now, can I glaze it? Yes, I can glaze it. Do I need to glaze it when it's in the anterior? I do sometimes, and then we can use glaze, and we can put some stains and glazes on these teeth. We do need to make sure we use a stain and glaze system that works with zirconia. So that's going to be typically the CZR glaze system that that Curare produces, or the Ivoclar system that Ivoclar does. Now, this is where we pre-sinter it. I use a very slow speed, slow RPM on a lab handpiece with some twist polishing burrs. and we can get some really good final prosthetics. When we go ahead and do need to sinter these restorations, remember, margins up, occlusal surface down. We do not want the margins touching this firing pad because it affects how it can sinter. So remember, margins up, occlusals down, and we can get some really cool things, cool effects if we need to also do some CZR, full contour paste and stains. But we do need to fire this again once it comes out of the sintering. We cannot do it at the same time. So that is one downside of when we're staining and glazing zirconia. It needs to be sintered first, then a separate cycle, typically 10 to 15 minutes to get this glazed. Now, once it's out of the oven, how do we go ahead and treat this particular crown, and how do we get it set up to get it the strongest adhesive possible, or the strongest cement possible? Is we do need to follow what was called the APC. This is kind of made famous by Dr. Blatz, who was a faculty member at Penn. But APC stands for air abrasion primer. Now, when we prime it, zirconia, it is not a silicon primer. We need a zirconia primer. So we do not silanate zirconia crowns. We need MDP, which is a specific metal primer, or a zirconia primer. And once we have that primed, then we can go ahead and cement this. So remember, APC, and when we talk about how do we treat this, is air abrasion. This is all done after we try the crown in, make our adjustments as needed. Then we do the air abrasion, so a little micro etcher, sandblaster with cojet, a little bit of the primer, a primer with MDP, not silica, and then cement. So how do we do it? It's 30 to 50 micron aluminum oxide powder, and we go on the internal surface very quickly and go ahead and get that sandblast. And it's the inside, the intaglio surface of that crown, and this will not look any different. The thing that we also do is we go ahead and clean it, and the way that we clean it is by using either the Katana cleaner or the IvoClean system. I lean towards the Katana cleaner in my office because it's multi-purpose and I can do it multiple things with it. So we go ahead, air abrasion, we do the Katana cleaner, we scrub it real quick, clean it out with air and water, and now we're setting ourselves up for success to have the best long-term prognosis for these crowns. And remember, why we need to do this is that the oral cavity is full of adhesive inhibitors. Saliva, blood, plaque, air, proteins get in the way and essentially get in the way of our bonding agents and our cements to weaken both on the tooth itself. Remember, it's a sandwich when we cement or bond something. It's tooth, cement, restoration. We need everything as clean as possible to get as strong of a bond possible and as strong of a cementation process as possible. So yes, we want to keep the tooth as clean as possible. We also want to keep the restoration as clean as possible. And we can see when we get saliva in the way of things, it's why when we bond, we need to have the tooth as clean as possible, that the bond strengths get lower. You can see when we go ahead and put Katana cleaner back into our crowns and clean it up, we get almost as strong as, get that crown just as strong as it was before we actually tried it in. When we're trying it in and not cleaning it out, or just cleaning it out with water and air, we're actually losing almost half of that strength when we do that. So add that cleaner into your system. And one of the reasons I like the Katana cleaner is that I can use it on both the crown. I can also do it on the tooth structure. The IvoClean system, it has a very, very high pH, very strongly alkaline, and you can't put it on teeth. So while I do 80 to 90 to 95% of my crowns same day, so I don't really need to clean it very well because it's only exposed to the oral environment for a matter of minutes. If I have a case where I'm doing a full arch or 6 teeth, or today where I'm prepping a bridge, I will also put the katana cleaner on the tooth itself, get that as clean as possible, rub it for 10 seconds, clean it, and I'm game on to get as strong of a bond or as strong of a cement as possible. And it's 10 seconds, clean it off. Now, this is the key with MD is when we prime and get something ready for our crown, we need to do it with MDP. And yes, we can bond to zirconia. It is a myth out there in the dental world that you cannot bond to zirconia. You just have to do it the right way. It's not hydrofluoric etching. It's sandblasting. It's not silane for the primer. It's MDP. Now, the great thing about this clear fill ceramic primer, which comes in the V5 system, is it has silane in it. It has MDP in it. So if you need to use this for multiple things, you can. So we need to find MDP. And the other great thing is when we talk about the Panavia SA cements that are out on the market, there's MDP in there. So you don't have to take a separate primer if we're going to be using this Panavia SA system. It's built into the cements already. And as we add the MDP, the strength of the cement to the zirconia restoration increases as well. And then when we actually get this to a chairside clinical decision is how do I make a decision whether I'm going to go ahead and bond it, whether I'm going to cement it, and whether I'm going to use that new category of cements that's been on the market for a couple of years, this self-adhesive resin cement. I like to live in this bonding world, the Panavia V5 system. The other ones are the Variolink, the NX3, the Prime and Bond. And then I will throw Panavia SA with this new bonding agent that Curare has come out with called Clearfill Quick. It's a very snazzy way to get something bonded in there in a very short amount of time. Or am I going to lead toward just traditionally cementing with it, which is one of the great reasons I like zirconia is if you have a nice retentive prep, go ahead and just cement it. Do that old-fashioned way of cementing it, that tried and true method of getting Relax or Zircad and cementing it. Or if you want a little bit of added extra strength, then go ahead and use the self-adhesive resin cement. But to me, it's on how long or how clean I can keep essentially saliva away from contaminating it. If I have this perfect prep, super gingival, I'm going to go ahead and bond it. If I have this super subgingival prep, I'm going to lead towards kind of the cementing or using the self-adhesive resin cements like the Panavia SA. This shows all the different research on different materials. I think the Panavia system has truly been the gold standard system. When we talk about bonding, that is the gold standard, and it's because of the MDP and all of the different materials that you can bond to. Yes, you can even bond to gold. We know that you can bond to porcelain and Emax, and that's the myth that's out there is you cannot bond to zirconia. You absolutely can. And you can see the strengths. Bonding to zirconia, you can get almost as strong as Emax as you can. So different materials, and the key is when we're talking about bonding zirconia, we need to have MDP in there, and not all MDP is the same. Just like not all zirconia is the same. The MDP original patent was made by Curare. That has expired. They still have their secret sauce recipe that shows that their MDP and their bonding strengths when MDP is in their products is still much higher than most of the other companies that have MDP now in there. Now, this is the new bonding agent, and I love this bonding agent for a couple reasons. Especially in my office where we have multiple doctors, it streamlines what bonding agent do we use with what. It essentially need one bonding agent in my entire armamentarium now. Essentially, I know that we're going to use Universal Bond Quick for several reasons. The reason I'm most excited for is if we look at when we open up the package of these bonding agents, I think all of us just start scrubbing it, and we scrub it for a couple seconds and then move on. And we just expect that bonding agent to work. When you actually look at when we're pulling out these little sheets of paper and the directions, almost all of the other materials on the market require at least a 15-second scrub, if not a 20-second scrub. And if we're using a 2-bottle agent, that's 15 to 20 seconds of scrubbing for both before we actually, this material, these bonding agents are fully resorbed by the dentin and the enamel. This new material, this Clearfill Quick material, has been on the market for I think about 18 to 24 months. Has a new hydrophilic monomer that allows the bonding agent to be absorbed in as short as 3 seconds. So their recommendations in the instructions is all you need is 3 seconds. 3 seconds, and when we're talking about my busy practice, I'm not going to schedule differently, but 3 seconds will definitely help me make that decision if I'm going to go ahead and bond something or cement something, or if I have this really challenging case where I'm trying to get a composite in there and I need to be as quick as possible to keep everything isolated. 3 seconds definitely helps me keep that tooth isolated, and I can be quick and efficient getting the bond in there, getting it cured, and moving on with my procedure and making sure that bond strength is just as strong. So you can see here, bonding strength to dentin, 3 seconds versus 20 seconds versus OptiBond Solo, which is 15 seconds. It's just as strong, but you only need to rub it on there for about 3 seconds. Again, if you want to self-etch versus total etch it, again, another research paper that shows enamel versus enamel here versus self-etch versus total etch. You can see the difference on how 3 seconds is just as strong as the other ones. And then this is my new go-to if I'm trying to bond something. The Panavia V5 system is great. It's super strong, the gold standard that is on there, but you do have to scrub it for that 20 seconds when you get that that primer, the tooth primer, that blue tooth primer. You need to scrub it for a while. And then you put the Panavia V5 cement in, and then you go ahead and cure it and clean it up. My favorite now is this one right here, the Panavia SA Universal with that Universal Bond Quick. I only have to put the bonding agent on there for a matter of seconds. I have the MDP that is in the Panavia SA, and I can get amazing bond strengths in a very short period of time. So I live in this world on the right side of the screen. If I have a very retentive prep, maybe I'm going to have some isolation issues, then I'm going to lean towards just the Panavia SA Universal. Just treat it like I'm cementing a crown. If I'm living in this world where I have enough isolation and I can get something bonded in there, I'm loving this Universal Bond Quick with the Panavia SA and getting great bond strengths, almost as strong as using that gold standard of Panavia V5. And the other great thing with Quick is I can do selective etch, I can do self-etch and let the bonding agent do it, or I can let the total etch do it. So I can have different, essentially, etching techniques. I can use that with the Quick. And the other great thing here I'm going to show you is when we're just doing composites, I can do selective etch, self-etch, total etch. Really no waiting time of applying the bonding agent because of that amide because of the amides in the Clearfill Quick, super quick, doesn't need to be absorbed or soaked in. And then I can go ahead and do my composites. The other great thing here is when you use Clearfill Quick with the Panavia SA, you don't need to cure the bonding agent. So again, saving me another 10 to 15 to 20 seconds worth of time. I can use any agent. I go ahead and put 3 to 5 seconds of this rapid bond technology of the Quick. I go ahead and air dry real quick, and I can go ahead and if I'm using the Panavia SA system, I do not need to light cure it, and it will self-cure when I'm going ahead and bonding the Panavia SA and tacking it on there. So super streamlined workflow, and it's what a lot of CEREC dentists are using. Great handling properties, easy cleanup. I'm loving this Universal Bond Quick with the Panavia SA with my Katana restoration on top. So how do I make decisions here? Can I isolate it? Is it a supergingival? Is it subgingival? Do I have a nice high retentive form? Is it 5, 6, 7 millimeters worth of retention? And how much enamel do I have? Do I have this nice ring of enamel around these teeth? And I'm able to bond more enamel rather than relying on the dentin to bond to. So this was 2 weeks ago. This was a normal, maybe not normal, it was a busy Thursday morning for me, but it gave me different opportunities to use the materials that we just talked about tonight in different ways and having very predictable results. We do use artificial intelligence in our practice. So this is an X-ray with the artificial intelligence telling us that blue is a restorative material. Red is an active cavity, caries lesion, so you can see that. You can see what I'm dealing with when we're going to be doing crowns 13 and 14. Younger kid in his late 20s, early 30s, not the best hygiene. So we go ahead and we get rid of the fillings, get rid of the decay. You can see we did some buildups. Again, because I only need one bonding agent in my operatory now, it's the Universal Bond Quick with some Majesty Universal Flow-It material. Get some buildups done on both of those materials. Now I do have a nice ring of enamel on these particular teeth, but his hygiene and his gums weren't the greatest. I didn't think I can get isolation long enough to go ahead and get these bonded in place. So we went ahead and this is the pre-op. Again, you can see the CEREC scan on the left, and then my preps intraorally on the right. We have the CEREC design on the left. We have my Katana 1 restorations on the right. And the before, the middle, and the after. And in this particular case, we have now the after. We're going to do some more crowns in the patient's lower left quadrant. You can see the red there, the margins that are nice and sealed. And what I did was I did buildups with the Universal Bond Quick. I used the Katana crown cleaner to clean out after we sandblasted. And yes, even if I'm cementing, I'm still going to go ahead and clean the inside of the crown with sandblast to get as highest strength as possible on the cement to crown restoration as possible. And then I will call it a cementing this crown with the Panavia SA system. Here's another case that came in, same day. This particular case, you could actually lift this restoration up when you flossed or put a scale in there. It had debonded on the distal half. But you can see, and I'm not surprised it debonded because it was so far subgingival when they did this. Probably hard to go ahead and get this essentially isolated enough. We go ahead and did a crown prep on this one. I am 3 to 4 millimeters subgingival in this particular case. I don't know if you can see how extensively I had to go under. There's no way I'm going to get this isolated. This is another one where I'm just going to go ahead and use Panavia SA and get this what I will call cemented. You can see before in the CEREC system how we can get nice margins. And yes, with the prime scan, you can have a huge depth of field, so you can go subgingival if you can get the right isolation. We can get the crown in place. And again, clean crown with the cement crown. In restorative, I had the restorative patient coming in, in my hygiene office. I saw a bridge that I had just done with the ridge block, so I snapped a photo of that. I was doing some interproximal cavities fillings as well, again using Universal Bond Quick with their Majesty Flow as a base, and then put some APX on top. I love the handling features of that material. So that's what I used on that particular case. And these are all what I'm doing while the crowns are being sintered, being milled. And then my last emergency for the day, patient came in with a broken cusp off of tooth number 2. This was a high and dry. I was able to keep my margins high. I had a nice ring of enamel. This is a case where I went ahead and you can see my crown prep was high and dry in this particular case. And I can go and do my buildup, Universal Bond Quick with some Clearfield Majesty Flow, did my cleaner, and I'm now being able to bond it in this particular case using Clearfield Quick down first. I don't need to light cure it because I'm using the Panavia SA system. And I have a very predictable workflow. Stuff that just works in my hands, like when it's all in the same family. Very strong aesthetic zirconia. I can do it essentially anywhere in the mouth. We talked about how we go ahead and not all zirconias are the same. So look into what you're asking for, what you're needing in your zirconia. It is it's like my Swiss Army knife. It can be used in the posterior now that we're up to 950 plus megapascals. Can be selectively in the anterior, or if I'm doing a full mouth rehab. I never like having to bond a full mouth rehab, just very, very difficult to isolate all that. So if I'm able to cement and doing a full mouth rehab, I prefer doing that. And the zirconias, especially Katana, has some great looking aesthetic zirconias that we can do it with the full mouth. We can do the preceding we talked about. We reviewed when do I bond, when do I cement, how do I make these decisions, and what materials do I use. That wraps it up. I was supposed to do it for an hour. I think I went 1 minute over, but I'm going to open it up to questions. And if you guys have questions, feel free to kind of post those in the chat, and I will be here for a couple more minutes. Let me kind of switch over, pull up my seat, and see if we have any questions going on here. I'll wait here for a few minutes. I don't see any questions at the moment, but feel free to type them in there. So I see one. Is it okay to adjust on the interior of the crown? My answer is yes, because it's the same material. Now, do I like to do that? No. I don't think I've ever had to do that with zirconia, because we're able to mill it and it's a much more intimate fit. Where I've had to do that was with the glass ceramics, and when we have issues with either the mill, essentially the drill bits not getting into the surface, an intaglio surface enough, and if we have some sharp edges, essentially that's where we have some issues. So my preference is to not do it, but do we have to in some particular cases? Yes. If you do have to adjust it, maybe we adjust it on the tooth itself to get it to fit rather than the interior part of the crown, would be my answer there. Another question I have here, is there dry versus wet mode milling? If you have an old CEREC, we're talking about 2016 prior, you did have a wet mode. You can wet mode mill this zirconia, you can, but it's going to take a lot longer for it to sinter. The water gets into the zirconia. You need to get that zirconia to evaporate, and then you can go ahead and sinter it. If you sinter it wet, you're just going to shatter that restoration. So yes, there is dry versus wet mode. I would highly recommend, especially if you're going to be doing a lot of zirconia, that you do dry mill it. So there's that. That's why I love the prime mill, because we can do a super fast dry mode in the milling chamber in under 5 minutes. Another question here is, do you ever have to adjust the contacts, or is it always a perfect fit? That's going to depend on you and your parameters and when you start getting used to the CEREC software and how you design it. I very rarely have to adjust it. You do have to adjust it, but you have to figure out what works in your hands, what works in your mill, and sometimes you do have to adjust it. Hopefully you get to a point where you get so good at designing and milling these and prepping these restorations that you don't. But if you do need to adjust the contacts, you can. I would wait to do that until you try the crown in after it's sintered. Do you use zirconia for a 4-unit posterior bridge? I will say you can. I don't like to do bridges in general, and that's a 3-unit bridge. I definitely don't use it for 4 units. If you're going to be using a 4-unit bridge, you're not going to be able to use it same day. You're not going to be able to use it with the chairside software of CEREC. You're going to have to send that out. You're going to have to, for a multitude of reasons, but the Speedfire oven at this point, You can only fit 3 units in there at one time. 4 units will not work. You typically also cannot fit 4 units into a posterior bridge block with CEREC. You're going to need the big pucks, which the lab has. I'm going to go down to the next question here. Is it okay to do a 1-wing zirconium Maryland bridge? Is the bond strong enough? There's a paper that Dr. Blatz quotes a bunch. If you are doing the right protocols, I think it is strong enough to do a 1-wing bridge, and they actually recommend that the success rates of Maryland bridges are actually better when you only use 1 wing. So if you're using the APC protocol, air abrasion priming with MDP, and then using the Panavia V5 system, now Maryland bridges will typically come off every once in a while, but I think it will be strong enough. If you want to, so I'm just going to leave it at that. Is you can probably get away with it, but you need to use perfect isolation. Maybe probably in that particular case, want to put a rubber dam on it as well. Those are, I think, are all the questions that I see currently. I'm hoping I answered everyone. If you do have any further questions, feel free to reach out to me. But like I said, Curare Katana is kind of the workhorse in my practice. Just works in my hands. I think it works in a lot of doctors' hands, and it has the benefits of both being aesthetic, but also super strong. So hopefully I answered all your questions. I will look at the question and answers one more time. And I think we are good. All right. Have a great evening, everyone.